Today, we're taking a deep dive into emphysema. It's one of the main diseases that falls under the umbrella of chronic obstructive pulmonary disease, or COPD. Now, this is a condition that really changes the lives of so many people, especially long-term smokers, because it causes this slow, progressive, and irreversible damage to the lungs. So let's take a look inside and understand exactly how this all happens. So what is emphysema really? Well, at its very core, it's about the destruction of these tiny, delicate air sacs in your lungs. They're called the alveoli. The best way to think about it is like this. Healthy alveoli are like millions of tiny, elastic balloons. You breathe in, they inflate. You breathe out, they spring back and push the air out. But with emphysema, the walls between these little balloons get destroyed. They all start merging into these large, saggy, floppy bags that just can't push old air out effectively. And right there, that's the fundamental problem. In this explainer, we're going to cover 4 main areas to give you the whole picture. We'll start with the basics of what emphysema is. Then we'll look at the main culprits behind it. After that, we'll go deep into the microscopic battle happening inside the lung. And finally, we'll talk about how it's diagnosed and managed. All right, let's jump right in with the most critical function that emphysema messes up, this simple, vital act of gas exchange. Every single breath you take is all about getting oxygen in and carbon dioxide out. And the alveoli are where all that action happens. So what you're seeing here is this chain reaction of damage. When those alveolar walls break down, all those tiny individual air sacs start to merge into fewer but much larger sacs. Now, why is that such a big deal? Well, get this. The surface area in your healthy lungs for gas exchange is roughly the size of a tennis court. Emphysema basically shrinks that tennis court down, way down. That means there's just far less space for oxygen to get from your lungs into your bloodstream. Your breathing just becomes incredibly inefficient. So, what's causing all this widespread destruction? Well, there are a few things that can contribute. There is one that just towers above all the others. Let's break down the main culprits. And no surprise here, cigarette smoking is by far the #1 cause. Tobacco smoke is just jam-packed with chemicals that trigger this constant chronic inflammation in the lungs. But it's not the only cause. There's also a really important genetic cause called alpha-1 antitrypsin deficiency. This is where your body just doesn't make enough of a key protein that's supposed to protect the lungs. And then, of course, long-term exposure to things like air pollution and certain types of dust at work can also play a role. To really get what's going on with emphysema, we have to zoom way in and look at this microscopic battle that's literally raging inside the lung tissue. It's a fascinating story of a very delicate balance being thrown into complete chaos. This illustrates that balance perfectly. See, in healthy lungs, you have these enzymes called proteases, and they're kind of like the cleanup crew, breaking down old, used-up tissue. But to keep them in check, you have protectors called antiproteases. Alpha-1 antitrypsin is the big one. Now, in a smoker's lungs, inflammatory cells rush in and just flood the area with way too many proteases. The protectors are completely overwhelmed, and that cleanup crew, well, it goes rogue and starts destroying healthy, elastic lung tissue. So here's how it plays out step by step. First, the smoke triggers that initial inflammation. This acts like a battle cry, calling in all those inflammatory cells, which then release a flood of those destructive enzymes. These enzymes then get to work, literally dissolving the elastic fibers that give the alveoli their shape and their springiness. Without that support, the walls collapse, the sacs merge, and this is critical. Air gets trapped inside. The lungs can't fully empty, and they become overinflated. Now, it turns out not all emphysema is the same. The 2 main types are really defined by where the damage is happening. Centria-Sinner emphysema, that's the one that's super tightly linked to smoking, it typically hits the upper parts of the lungs. On the other hand, Panasinar emphysema, which is caused by that genetic alpha-1 deficiency, tends to damage the lower parts of the lungs more evenly. Knowing the type really helps doctors figure out the root cause. Okay, so we've seen how all this damage happens inside the lung. Now let's talk about how patients and doctors can spot the signs and, what can actually be done about it. The journey to getting a diagnosis usually just starts with a person noticing that something's not quite right with their breathing. So how is this damage actually found? Well, the absolute key symptom is a slow, progressive shortness of breath. It's not something that happens overnight. It's just that over time, it gets harder and harder to do things that used to be easy. Clinically, doctors look for some classic signs. A barrel-shaped chest can develop because those lungs are just constantly overinflated with trapped air. And you might hear patients called pink puffers. They're pink because they're working so hard to breathe that they actually manage to keep their oxygen levels pretty normal. But they're puffers because they're constantly using their neck and chest muscles, gasping for air. Now, to confirm a diagnosis, doctors turn to a few specific tests. Pulmonary function tests, or PFTs, basically measure how much air you can blow out and how fast. With emphysema, that amount is way down. Then you have imaging. On a chest X-ray, the signs are pretty clear. The lungs look way too big and overinflated, and the diaphragm muscle underneath gets pushed down and flattened out. And of course, a CT scan can give an even more detailed, undeniable picture of that destruction. So, what's next after a diagnosis? This is a really crucial point. The damage from emphysema is permanent. It cannot be cured, but its progression can absolutely be slowed down. And there is one single, overwhelmingly important step that a person needs to take. I really can't overstate this. Quitting smoking is the only thing that can truly change the course of this disease. It's what stops that ongoing inflammatory fire that's actively destroying lung tissue. Pretty much every other treatment is about managing the damage that's already been done. Beyond quitting smoking, management really focuses on improving symptoms and quality of life. Things like bronchodilators can help relax the muscles around the airways to make breathing a little easier. Pulmonary rehab helps patients exercise safely to strengthen their breathing muscles. And for the most severe cases, you might see oxygen therapy or even big surgical options like a lung transplant. So we've seen that the damage from emphysema can be managed, but it can't be reversed. And that leaves us with one final critical question. Knowing what we know now about the overwhelming cause, what is the single most powerful action we can all take to protect our lungs from this permanent damage in the first place?